everyone, welcome to the channel. My name is Ashish and I'm a junior doctor working in the UK. In today's video, I'll be talking about the day in the life of a GP trainee. I started GP training in February this year and I decided on making this video so that I can give you a perspective of how the life of a GP trainee is in the UK. If you want to support my work and see more such videos, click on that like button, share this video and subscribe to this channel. Let's start. Okay, so let's talk about the general overview of life in GP training. So it's basically a 9 a.m. to 5 p.m. job. You have to work 5 days a week. And apart from this, you have to go for some out of hours practice, which has to be in a different or your own GP surgery. And it has to be out of this 9 to 5 hour period. There are no weekday on calls, there are no weekend on calls, there are no night shifts. It's just that you have to do some amount of out of hours practice apart from your 9 to 5 jobs. A typical week consists of morning and evening clinics. Out of the 5 days, 3 days are half days for a trainee, and the other 2 days I have one morning clinic and one evening clinic. On those 3 half days, one of the half day is a tutorial which is a one-to-one teaching session between me and a GP trainer, and I can pick up any topic which I'm not good at and we can have a chat about that. The second day is a group teaching, which is a teaching for all of the GP trainees together, and it can be either in a lecture theatre based setting or it can be on Microsoft Teams. The third one is self-directed learning, in which I can do whatever I want in terms of improving my learning and improving on my practice. So I can maybe sit with another GP in their clinic, I can sit with a dermatologist, maybe I can sit with an optician or any specialty doctor so that I can learn from them. And the last thing is the business discussion meeting. Now this is something each and every GP surgery has, and this is a meeting in which they take all the major business decisions for that week, and this is around 30 minutes meeting per week and you have to attend this as well. Let's talk about a non-teaching day, which are 2 out of 5 in a week. And this consists of a morning clinic and then an evening clinic. So I usually go to work at 8:30 a.m. and I glance through the morning list of patients so that I have an idea of what I'm going to see and I can brush up on things which I'm not familiar with so that I can give the right advice to the patients. After I go through this list, the morning clinic starts at 9 a.m. and it finishes at 11:30 a.m. When you start as a GP trainee, you have 30 minutes per patient to begin with, but it reduces to 20 minutes and then 10 minutes as you progress in your GP training. So it is 20 minutes for me currently. These consultations can be face-to-face or they can be telephone-based consultations, or they can be video call with patients. After the morning clinic finishes, there's a hot review with one of the GPs in the practice, and you go through all of the patients and they tell you whether you have done the consultation well or not and what areas you need to improve on. After this hot review, I have to usually go for a home visit, and this can be 1 or 2 depending upon how busy it is. After I come from the home visit, I type everything up about the home visit patient and make plans for them, and after that I start with my afternoon clinic, which is usually from 2 o'clock to 4:30 in the afternoon. And after I finish with this clinic, I again go for a hot review, and that's the end of the day. There are some additional responsibilities apart from these. So you will have medicine requests coming up on your system, and this will be in between your clinic. So for example, a patient could be requesting some diazepam for back pain, and you'll have to find out why he's having the back pain, whether he needs that diazepam or not, or do you need to call him to see him before giving the diazepam. So these are all the medicine requests which you have to handle in between. Then you have test results coming up. These are some of the previous blood tests which you have requested on your patients, and the results keep coming up on the computer while you are in your clinic. So you have to sort these out as well in between. Then you have referrals. So if you see a patient who needs maybe a neurology referral or surgical referral, then you'll have to type this letter in between your clinic. After this, you have referral updates to respond to as well. These are your previous referrals to different departments, and you have to see their replies and act on them. And in between, when you finish your morning clinic and you're about to start your afternoon clinic, there could be a lot of paperwork which needs to be filed up. So you'll have to go through that paperwork as well and take decisions whether these patients need to come in to be seen again, or do you have to give any medications for them, or make any more referrals for them, or you have to maybe book an appointment with a nurse so that they can get their bloods checked, maybe get their blood pressure checked and things like that. And apart from that, you have workplace-based assessments in which you have to complete CBDs, mini KEXs, and lots of them, and maintain a portfolio as well. So that is the life of a GP trainee in the NHS. This can slightly differ from one GP practice to other, but it is generally how the life of a GP trainee is in the UK. If you are confused about whether you should take up GP training or not, I would advise that you should go for a GP taster week, or you should sit with one of the GPs and see what work they do. It's usually a myth that GPs chill out in their surgery, they do nothing and they earn very well. But unfortunately, this is not the case. It's a very stressful and busy job. So don't opt for GP training if you're not ready for it, or if you haven't seen what the work life of a GP is. That is all for this video. I hope that you liked this. Click on the like button, share this video, and subscribe to this channel. I will see you soon. Thanks a lot for watching.